Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Today, I'm excited to announce a new public service campaign that encourages Orange County residents to spread positivity throughout the community. The Orange County Healthcare Agency is sponsoring the Positive Vibes campaign, which will bring together some of Orange County's most well-known residents to join us in spreading life-saving messages about basic COVID safety in a positive, feel-good way. The OC icons joining our campaign include Wing Lam and Ed Lee, founders of Wahoo Fish Tacos, who joined us in supporting local law enforcement and our model business to bring Orange County in a positive direction during this crisis. Also joining us is professional surfer Pete Townend, professional surfer Courtney Conlogue, professional surfer Tosh Townend, artist Melissa Murphy, musician Jim Quilly, and comedians Chet and JT. Beginning August 24th, they will be joining Gary and Shannon on KFI at 11:50 a.m. on Mondays and Wednesdays to discuss their contributions to OC culture and spread positive vibes. The schedule will be posted on the Orange County Healthcare Agency website. A huge part of this campaign was made possible by native Orange County artist Melissa Murphy, who designed 2 masks based on her paintings. The county will be giving out 45,000 of these masks. We want people to feel good about doing their part to help stop the spread of the virus. This campaign is a big part of ensuring that we can beat COVID-19. Next, I want to address the recent heat wave we have been experiencing in Orange County. If COVID-19 isn't enough, California and the rest of the West Coast are facing a historic heat wave. Unfortunately, the libraries, businesses, and shopping malls on which may rely to stay cool in hot weather are closed or at limited capacity because of coronavirus restrictions. It is very important to make sure we are all careful to avoid heat sickness. Some important tips including drinking plenty of water, wearing light, loose-fitting clothing, staying out of sun as much as possible, and wearing a hat and using sunscreen. Limiting hard physical activities outdoors or in non-air-conditioned buildings, it is also very important. It is also vital to never leave children, elderly people, or pets alone in a closed cars. Remember to check on neighbors and loved ones who are at high risk, including seniors who live alone, people with heart or lung disease, and young children. Safe cooling locations are open across the county. You can find more information at 211oc.org or call 211. I also wanted to make this time to address a letter received yesterday by the Board of Supervisors from our congressional delegation about our Veterans Services Office. First and foremost, I fully support our veterans, and we want to ensure access to federal government programs even during the time of COVID-19. We agree and have made the VSO a priority. That is why the board has allocated $1.2 million in the county's budget just for our Veterans Services Office. It is important for our veterans and our congressional delegation to understand that we use local county dollars and employees to help our veterans access vital federal services. Our VSO staff assist veterans and their dependents in filing for any benefits with the United States Department of Veterans Affairs that may be appropriate. The County of Orange does not get reimbursed by the federal government for this service. We receive a small allocation from the state, about 17% of the VSO budget. 83% comes from the county's general fund. However, we understand that there have been longer than average wait times to help our veterans. Veterans that are coming from other counties from across Southern California. Those counties have closed their VSO offices. Orange County has kept its doors open during the COVID-19 pandemic. As such, we are working on hiring more employees to assist with the need during this time. Last year, the county received a similar letter from a member of our congressional delegation. Then Chairwoman Bartlett responded on behalf of the board, asking to partner together to find additional resources to support the great work of our VSO. A year later, we are being asked the same questions. We will continue to work with the resources we have available to help California veterans navigate the complex VA bureaucracy. We continue to welcome the support of our congressional delegation in this effort. The board will be responding further to members of congressional delegation, but I felt it was important to make this clear. The congressional delegation must understand that Orange County is serving not only our Orange County veterans, but veterans from all over Southern California. Finally, I want to update you on the school reopening waiver process. Healthcare Agency Director Dr. Clayton Chow informed us that 10 schools who submitted waiver applications were approved by both him and the state yesterday. An additional batch of waivers were sent to the state and are currently waiting for the approval, but it seems like we just got more approved. Especially in my district, I thought private schools are all approved, but City of Los Alamitos Unified School District K-6 just got approval. So congratulations, and we are ready to open. Our first priority is to protect public health and safety. With the state waiver process and careful review by the healthcare agency and approval by the state, we can work together to make sure schools open safely as the new school year begins. Dr. Chow will be able to address this further in a few minutes. In closing, I want to continue to remind the residents and visitors of Orange County to please wear a face mask, mask or covering when you are in a public place and unable to properly social distance, and following hygiene and social distancing guidance. Protecting public health by social distancing and wearing a mask will allow people to go to work safely and responsibly so they can pay their bills and feed their families. Today, I'm joined by, actually, CEO Kim is not here, right? So Orange County Healthcare Director and Acting County Health Officer Dr. Clayton Chow, who will provide an update on the county's COVID-19 numbers. It looks really good, as well as the county's response. I am also joined by Ed Lee, the co-founder of Wahoo Fish Tacos, who will share more about the Positive Vibes campaign. And I'd love to invite Mr. Ed Lee to the podium at this time.
Hi, thanks for having me here today. I'm so happy that you guys are making this a part of this campaign. So we at Wahoo's been serving food with great vibes for the last 32 years. When the county supervisor asked us to, be part of this distributing the mask, we were so excited because the mask is not about about us. It's about the safety of the public and the safety of our employees. We want to be able to do this so we can get back to business as soon as possible. With all, our goal obviously is to open all the restaurants ASAP, but we want to do it safe and correct. So the mask, please, it's important. Meanwhile, we're still open for takeout. I sound like a commercial, but we're open for takeout and pickup. So, and also don't forget to listen to us on KFI 640, Gary and Shannon show on September 2nd. So thank you again. Thanks for having me.
Thank you, Chairwoman Steele and Mr. Lee. Good afternoon, everyone. I am Dr. Clayton Chow, Orange County Healthcare Agency Director and Acting Health Officer for the county. I'm so excited about the Positive Vibes campaign the county is launching today, so thank you for joining us. I'd like to start by providing an update on the cases reported to us today. Our cumulative case count will increase by 429 cases to 44,936 cases. 23 deaths will be reported, and our hearts sincerely go out to the families and friends of those lives lost to this virus. Our cumulative deaths to date is total of 856 residents. Just yesterday, my department was saddened to announce Orange County's first pediatric death related to COVID-19. A teenager who has significant underlying health concerns. Her death will be included in today's figures. This tragedy serves as a reminder that underlying health conditions put individuals of all ages at greater risk of complications and severe illness from many communicable diseases, and the important role of public health departments and the medical professionals as well as the community play in helping to educate the community about ways to improve their overall health. You've heard me talk about this before, that in the time of pandemic, we tend to forget that the other chronic health condition that happen in our community, especially to the vulnerable community and our children. It is time that we really need to look at our community health equity and come together with the community to solve these chronic issues that happened before the COVID and will continue to happen. We must continue to address health inequity here in Orange County to ensure all of our children would have a bright future. I want to encourage the community to continue to practice physical distancing, wear a face covering, and wash your hands frequently. Learn more at ochealthinfo.com/forward. Slow the spread. Late yesterday, we received confirmation from the state that August 19, which was yesterday, was the first day that Orange County is below all of the state data monitoring thresholds. As a reminder, we need to maintain this status for 3 consecutive days in order to be removed from the county monitoring list. If this trend continues, Orange County will be off the monitoring list on the state website on day 1, which is this Saturday, August 22nd. The projected day 15 would then be September 6th. On our data dashboard, we have added a countdown clock to track how many days we have been off the monitoring list. And hopefully, if everything's go well, this Saturday, the clock will start at number 1. Based on the K-12 reopening framework, once Orange County has been off of the state's monitoring list for 14 days, all in-person instruction can resume. Once a county is off the list, we are still subject to the governor's July 13 order with respect to sector closures, indoor operations shall remain closed even when a county is removed from the county monitoring list until the state health officer modifies the order and authorizes the reopening. If you remember earlier this week, Governor Newsom announced that he and the State Department of Public Health might issue a new guidance for reopening sometime next week. Now I would like to address the TK to 6th grade waiver process. Yesterday, we received word from the state that our first batch of elementary waivers have been approved, and these schools may resume in-person instructions. As Chairwoman Steele announced earlier just a minute ago, today, about half an hour ago, we also received approval for the second batch. That brings us to 24 elementary school and 1 public school district. So happy that it's happened to be in your district, Chairwoman Steele. We have tried to make the process very transparent for the community, and we require each school to post their waiver application as well as their reopening plan on their own website so the parents, teacher, and the public may review it. My web team is working diligently today to ensure the list of schools that have applied for the waiver and those that have been granted the waiver is posted on our website. I am told this work will be completed tomorrow. If parents or community members have concerns about a particular school's waiver application or reopening plan, they can email us as eteam@ochca.com. That email again is eteam@ochca.com. Our public health nurses and doctors on staff have called the schools and in consultation to ensure that they have a solid reopening plan. Additionally, we support these schools by offering testing for staff and students, and we also have stood up a full medical team in partnership with CHOC Physician and UCI Physician group to ensure that there are pediatricians as well as pediatric infectious disease specialists standing by to guide and assist when needed by all schools. We understand that there are risks, but the majority of applications have large staff and parents support. We weighed in the risk and the benefit of having in-person education. There are parents who only want online education for their children, and we encourage that, especially children who are at higher risk because of multiple health conditions. Please visit ocinfo.com/forward novel coronavirus and look for the school waiver process section of the homepage for more details. Thank you. And at this time, I would ask Molly to come up so we can go to the Q&A question section. Thank you.
Thank you, and we'll take questions at this time.
And again, if you do have a question, please press 1 then 0 at this time. Our first question comes from the line of Margaret Carrero with KNX. Please go ahead.
Thanks so much for taking questions. I had a quick question with regard to the trend and the getting off the watch list. I know that yesterday was day 1. Where do we stand today on day 2? Are we moving in the right direction to get to day 3 in order to get off the watch list? And also, can you speak a little bit more about the schools that received the waivers? How quickly will they be allowed to reopen for in-classroom learning?
And I'll go ahead and bring Dr. Chow up to answer those questions.
Hi, Margaret. Thank you for that question. Yes, our trend is good. Our number is decreased a bit today, even further. So I'm hopeful that it we continue to do so. The reason I say we is that this is the work of all of us, including the community, and we truly appreciate that. As it relates to school, for the K to 6th grade, waiver application for those schools that have their application approved by the state. They could open immediately. For the school that have submitted their application and have not heard back yet, we're working very hard in processing those applications. I know I'm going to be submitting the request to the state today for the third batch of roughly probably around the same number of 15 schools or so. As is related to all school K to 12, the moment that we step into day 15 of being off the monitoring list, technically all school will be open, will be able to open for in-person education. So, like I said, if all go well, and I am very optimistic that all will go well, September 6th will be day 15 where all of the school will be open for in-person education. Thank you.
And our next question comes from the line of Spencer Custodio with Voice of the OC. Please go ahead.
Hi, thanks for taking our questions. This one's for Dr. Chow. The new state guidelines are coming out next week, and Governor Newsom has said he's been speaking with, various health officers like yourself about it. Can you share with us kind of what some of those new guidelines might be? And also, as a follow-up to last week, what's the positivity rates look like in the hotspots in Anaheim and Santa Ana this week?
Hi, Spencer. Thank you for asking that question. I don't know. I wish I can tell you I know what the state guidelines that the governor is going to issue next week would speaks to. I assume that we will get the call and we will start the discussion sometime this next few days, including the weekends. I want to let you know that very often we also have conversation with the state on the weekend as well. As far as the number of testing in Santa Ana and Anaheim, we've seen a variation, depends on where the testing site is at. As you remember, the testing site for Anaheim and Santa Ana is mobile, meaning we go to different school, and so I think the range was somewhere we range from 17% to about upper 19% still. But we do have certain areas that have a lower positivity rate than others. Thanks for that question, Spencer. Operator, next question, please.
The next question comes from the line of Amy Taxon with the Associated Press. Please go ahead.
Thanks again for taking our questions. This one is also for Dr. Chow. If you could just go back to the school waivers question, if you could let us know how many applications have you received in total, and roughly what share have been approved by the county to reopen? And if some aren't being approved, what has been missing from those applications? And then turning to Spencer's question, I don't know if you can talk at all about what changes, if any, you might be recommending to the state for the reopening of businesses like restaurants, gyms, et cetera, to prevent another surge in cases, especially since the county previously acknowledged that indoor dining was a source of some outbreaks.
Thank you for that question. So let me address the school first. Up until now, I think we are close to 100 applications. Most of them are from private school, charter school, as well as secular schools. As I mentioned earlier, we now have 24 private schools and one school district, public school district. Out of the 24 private school, two of them have more than one campus. I think two of them have, one have two campuses and the other one has four. So technically it's more than just 24 school. And then the LaSalle Unified School District applied for 6 different school sites. So a significant number. In terms of denial, so far we've been able to review and approve So the 24, and then today I've just approved 11 on my way here. I would not have to deny anyone yet, but I'll tell you, almost all application that's submitted, my public health nurses have to call the school back to have conversation, to get missing information, perhaps a misunderstanding of the question on the waiver application. And most importantly, we want to ensure that all of the application as well as the reopening plan are publicized on the school website so that it is transparent for the parents, for the teacher, and for the community. And we do have parents and teacher anonymously send us email, raise some concern, and we were able, to tell you, I personally called the school and addressed those concerns, and they were quickly resolved. And then so we would not consider an application complete until all of those elements have been addressed and all of the questions in the waiver application have been answered. And then that's where we review and then make a final a decision on approving or not before we submit it to the states. Hopefully tomorrow, when our website is done, you'll be able to view which school have submitted the application as well as following their progress on whether or not they've been approved or not approved. As far as the testing, I think that was your next question. The second question, I think testing in Orange County, we have capacity. We will make sure that we have increased capacity for the community. We want to make sure that we have a handle on the transmission rate in our community. In fact, the state just issued a question to me right before I came in, was, well, how well are you doing in Orange County? And I'm happy to inform you that as of yesterday, the number of testing that we've been able to perform in Orange County, public and private, way above the number that the state require. So if you remember, the state required that each jurisdiction, meaning county and some city, should be able to have the capacity to support testing of 150 individual per 100,000 population. And we are currently at 195, I think 95 or 97. So we are way above the threshold that the state require. And we have been remaining somewhere between 190 to 200 for the last 2 weeks now. So I think we're doing very well. As is related to my personal recommendation, I think that we all learned, not just Orange County, I want to repeat that, we all have learned that the earlier reopening during our second stage brought about transmission. So I think we have learned from that lesson, and my recommendation would be we will reopen in phases. We would need community group to come together. I'm looking at Chairwoman still because she was the one who started the business advisory group. I'm going to approach the Chairwoman to look at getting a group of community together to help us prioritize and making decisions together as a community as to how do we phase in the reopening of the different sector in days to come. And if all goes well, September 6th will be our first day of the 14 days. So we have about 2 weeks or so to make some significant decisions. So Chairwoman still give me a thumbs up. So it looks like we got a path to go forward for Orange County. So that is actually a very important question that we have to address for those counties that are stepping off the monitoring list. So thank you for that question. Operator, next question, please.
And the next question comes from the line of Ian Wheeler with Orange County Register.
Hi, Ian.
Thank you. Hi, Dr. Chow. I was so it sounds like if we come off the watch list on Saturday, not much is going to happen on Saturday.
Right.
That it sort of starts a clock.
Right.
For schools to reopen down the line if we stay off the watch list. And it sounds like plans are still being formed on what level of reopening Orange County is ready for. But what policies, I know the other name of the game is to keep us off of the county watch list going forward. So what new policies have we learned while we were on the watch list that we could apply to keep ourselves off of the watch list as we enter into fall?
Yeah, Ian, that's really important. I think I think what has helped us to really decrease the number of infections is truly ensuring that we do our best in following the non-medical approach to this pandemic. And that's the only one that's available for us, and that is wearing face covering, stay home when you are sick, stay home when you don't need to go out, keep physical distancing. When you have celebrity like Mr. Lee from Wahoo encouraging the community to do that, I think it just sounds better and it come across better than coming from a doc like myself. I think that if our community put together an effort to do this, we can beat it. We can reopen it safely, because it's happened in other countries, happening in other jurisdictions when we have a community effort in doing this. And so now I'm going to get emotional. I'm sorry. I think for me, the most important piece is about our community's ability to bring our children back for in-person education. I'll tell you, since the waiver starting this last 10 days, I wake up every night in the middle of the night, and the first thing came to my mind is this business of bringing our children back for in-person education. Do I have fear and anxiety? Of course I do. Do we expect that there might be outbreak? Of course we will. But we have to do it. We know that this lockdown have causes emotional turmoil for some of our children, and we know that in-home online learning is not the best education, because besides learning the knowledge, our students need to come together in a community, in a classroom, so that they can learn how to interact with each other, and they can be modeled by the teacher on how to interact with adults. And this in-home lockdown situation have caused that. I mean, even the governor admit to that. So I really appeal to all of us as the adults in the community. Please wear that mask. Please stay physically distant from each other. Please stay home when you're sick, because we have to create a safe environment for our children to come back to school, as well as for the teacher. I'll tell you, I get emotional when I read some of this application, and there are letters from teacher who say, I am a vulnerable person, but I'm willing to do this. I want to make sure that we bring our children back. So if you have individual teacher who are vulnerable, risk their life to do this for our children, I don't think it's too much to ask the adults in the community to do this. We have to do this. And I get emotional when we have a death of a young life, but we suspected that for our children who have multiple health conditions that put them also at risk, that we have to do this together. We cannot ignore it, right? So thank you for that question. I will power on this every week when I talk to all of you. I would implore all of us as the adults in the community to really push our community to do all of this non-medical intervention to COVID-19. So thank you. Next question, please.
The next question comes from the line of Ron Lin with the Los Angeles Times. Please go ahead.
Hi, Ron.
Hi, thanks for taking the questions. I wanted to go back to the question about Santa Ana and Anaheim. To compare these two cities with the county baseline, can you tell me what the county positive test rate is for the comparable time frame? And can you talk about the reasons why these two cities might be seeing such a high positive test rate, since these cities have a large Latino population?
Yes.
Is this a data point that shows how Latino residents are being hit harder by the pandemic?
Yes.
Thank you.
Yes. Please forgive me. I don't have the exact number today for Santa Ana and Anaheim, but I know it's double digit, right? It's, I think, 15 or 17 or so. The testing positivity rate for us all as a county today is 5.7%. Compare that. We know in these two cities, in these 8 specific zip codes, we have the most vulnerable populations, vulnerable from economic standpoint, vulnerable from housing standpoint. So people are living, double, triple. I live in those cities before I know. that was the norm for the community. And we do know that people who live in this two city are people who do not have the luxury to telecommute, to stay home. They have to go out. They have to risk their life to earn a living, to put food on the table and a roof over their family's head. We know that there are inequity in this community, and that's why we've done everything we can to really support the community. It has to be a public-private collaborative effort in doing this. And that's why I'm so grateful that we're able to start the Latino Health Equity Initiative, where we bring together school, faith-based entity, city government, county government, city health agency, community-based organization, academic like UCI, community clinic to come together to solve this issue. Like I said before, we've been so concentrated on COVID-19 for the last 6 months, but we completely forgot that before COVID-19, we have health equity in pockets of our community, and we have to talk about that. We have to address that. COVID-19 really pushed the inequity to the forefront, and we need to do all of that together. So thanks for that question. Next question, please, operator.
And the next question comes from the line of Chip Yost with KTLA. Please go ahead.
Oh, hi there. This first question, I think you answered while I was muted. It's just a quick one. I just wanted to know, these elementary schools that have been granted the waivers, they're free to start in-person classes immediately. Is that correct? That's my question. And the second one has to do with how will this affect businesses if we do indeed go off the monitoring list this weekend? I think in some of your earlier communications, you said it won't affect the indoor activities that some businesses are banned from. Is there anything it could have a positive impact on as far as businesses that have had to change operations or close down?
Right. Thank you for that question. The first question is, as soon as a school receives a personal call from me saying that the state has approved their application, we follow up by a formal letter, and pretty much they can open in-person education right away. As far as getting off the monitoring list, as of July 13, the order from the state health officer as well as Governor Newsom was that even if a county stay off the monitoring list for 14 days, which we will, I'm very optimistic, the only business sector that would allow to reopen would be school, right? But I know that the governor and the State Department of Public Health have some plan on having new guidelines for the reopening sometime next week. And I can't remember who was it that asked me the question. Personally, I think that the next reopening phase should be a phase-in approach, and that we need to have a conversation and make decision. It's not going to be easy. It's going to be tough. And I'm looking at Chairwoman still because she's going to steer us in that direction. We're going to have to decide which business sector to bring back and reopen first. I think that's the best way to do is gradually bring certain sector back, one at a time or a couple at a time, and then gauge our epi data and make further decision. So thank you for that question. Next question, please.
And the next question comes from the line of Matthew Leslie with the Fullerton Observer. Please go ahead.
Hi, Matt.
Hello. Hi. Good afternoon, Dr. Shao.
Good afternoon.
I have a kind of a general question. It may be hard to estimate this. I don't know, but you referred earlier to the first and second stage reopening that was then sort of shut down again. Do you have a sort of maybe a ballpark estimate of how many people became sick and how many people died, do you think, unnecessarily as a result of that opening?
So that is a very important question. I don't, it's very hard to say whether or not people die unnecessary. Not all. I mean, we do know that a large percentage of the death in Orange County occur in congregate living, like skilled nursing facility and what have you. I guess You can submit the question again, and we can go back into the data. What we can tell you is what are the number of deaths occur from what time frame. We won't be updated. Remember, for any death to occur, it takes at least 7 days or so for us to get the data. So we can give you a rough estimate when we reopen up until like about a week ago, how many deaths was added to the list, as well as how many people, the number of people who infected get to the list. But it will take us a couple days to give you that number, specifically the number of confirmed infection, because we have to go back and scrub the data every day, as I mentioned before. So we can look into that. Operator, next question, operator.
And the next question comes from the line of Brandon Foe with Voice of the OC. Please go ahead.
Hi, Brandon.
Hi, Dr. Chow. Thank you. So my question is about the heat wave. Is the county open to the idea of opening up even more pop-up cooling centers in areas either of high density or large populations of low-income apartment renters where we know there would likely be less access to air conditioning? I know cities throughout the county have these community centers that provide such services, but does the county see an additional need for preventing residents and populations like homeless people from, going elsewhere in public to cool and possibly risk transmission? And also, is the county concerned about, the risk of transmission at these existing cooling centers that are already operating out there?
I guess I can answer your second question. There's a state guideline on how to open the cooling center, and I know through our emergency operations center, all the cooling center in the county have received that guidelines, and they have to follow the state recommendation to reopen. As far as part of your question, I know just this morning I received a list that there are over a dozen cities that have opened up their cooling centers, but as far as the county, I don't know. Please submit the question to Ms. Molly Nicholson. We will work with our public work and department to get that number for you. Thank you, Brandon. Next question, please.
The next question comes from the line of Nick Gerda.
Hi, Nick.
Voice of the OC. Please
Hi,
go
Nick.
ahead.
Hi, Dr. Chow. How
Hi,
are
Nick.
you?
Good, thanks. How are you?
I'm doing okay, hanging in there. I had a question about testing capacity and reopening of schools, and the numbers on that. There could be a lot more schools, obviously, potentially approved to open in person in the coming weeks. And I think the state has requirements where if a student tests positive and their whole class in certain circumstances would have to get tested to identify low outbreaks. That seems to create a much bigger demand for testing if outbreaks occur. And I was curious if the county has enough unused testing capacity each day to handle that school testing requirement, and the numbers on that. How many unused tests are there each day in the county's testing network, and what's the projected need as far as what would be needed for these school testing requirements?
Great question. Of course, we calculated all of that before we made the offer to school, our testing site, the county's testing site, especially the super site, as the access point for the school, not only their staff, but also the student. I can tell you in our super site, currently, we are running half of our capacity. So let me say this. The entity, the provider that we contract with, including the lab, guarantee that they can run up to 5,000 tests a day. Currently, we're only running about, at most, a high 400s a day at Anaheim Convention Center. And then we are slated to next week open another test site. It's going to be in Chairwoman Steele District. we're going to talk about that. There will be a press release next week on it. And so I'm very confident that we have a very good capacity to support the school. And that's the reason why we approve it. And I think that we are the only or the few county that truly make a commitment to support our school in getting the testing capacity for them. So I'm confident that we can support them.
And do you have any ballpark numbers on what the capacity is right now and what the need is?
So right now in Anaheim, like I said, they run about 400 or 500, just that one site a day, but the capacity is 5,000 a day. So we have about 4,500 specimen collections and exam and specimen processing per day. That is will be available for the school. Okay.
Or do you estimate that'll be sufficient?
Sorry?
And you estimate that'll be enough for the school reopening?
Yeah, I believe so. Yes.
Thank you, Dr. Chow.
Because that's the only, remember, Nick, that's the only test site. And actually, you're going to force me to say something. I'm also in the process of increasing capacity beside those sites as well. So more to come, Nick. Operator, one more question, please.
And the next question comes from the line of Norberto Santana with Voice of OC.
Hi, Norberto.
Dr. Chow, thank you so much for your work. Thanks for taking questions.
Thank you, sir.
Just a couple of quick questions that either you or Chairwoman Steele can speak to. I just found out recently that we only have about 50 food inspectors that are expected to cover 10,000 restaurants. And we know that when we opened up previously, epidemiologists told us that they believe that many of the COVID transmissions occurred at restaurants. While I understand that you guys have done education programs, I'd just like to ask you and Chairwoman Steele, she's still there, do you think 50 health inspectors is enough? I understand education, but don't you also have to have some semblance of a realistic enforcement process to keep consumers safe? And so I'm curious, do you or Chairwoman Steele think that 50 food inspectors is enough for 10,000 restaurants?
Right.
And as a follow-up, I'd like to know on that education program that you're doing with KFI Radio, how much are those spots costing? Does the radio station donate those? Are the people, the celebrities involved donating their time? Is there any cost to taxpayers from that program?
Thank you, Roberto. I think your first question is very easy for me to answer. Unfortunately, Chairwoman Steele has stepped out of the room. Obviously, the 51 is not enough for a 10,000 restaurant, and I'm sure I will have a conversation with all of my board, especially Chairwoman Steele, on that, and what is the bottleneck on why we're not able to bring in more inspectors. So more to come. As far as the second question, Molly, do we know the answer to the cost, Molly? Yeah, we'll follow up with you, Norberto. I know for sure we didn't pay Mr. Lee to be here today, so but we can get that information for you, Norberto. Okay.
Do you have a sense of how many inspectors you'd like to see? I mean, I know it's a huge number of restaurants. I mean, and I guess I'm just curious, how do you attack that?
Yeah. So
what do you think you'd need?
Yeah, I don't know offhand. I need to talk to my director for the environmental health program, particularly the restaurant side, and of course I hear you. I mean, with the COVID. Testing on top of it, we really need to look at how do we make sure that we are able to inspect all of the restaurant we have. And that's why the idea of doing education, doing incentive for restaurants to really keep up with what they're requiring to do to reopen came from that calculation that we don't have enough staff to go out and inspect all 10,000 restaurants at once. So we encourage the restaurant to do what they're supposed to do to ensure the safety for our community, and hopefully they will partner with us on that campaign. I know that OCBC, the Orange County Business Council, our partner in this Safe Dining OC campaign, is getting ready to do mass public education and outreach into the restaurant to encourage them to apply for this grant. I mean, so far we have, I want to say over 700 applications already. So that's a good start. We are expecting a flooded number of applications once the outreach campaign is initiated by OCBC. So, but your question is very important, and I am sure.
Do you think it'll affect? Do you think it'll affect your timing when you were to open restaurants based on how much enforcement? So, for example, you said you were going to talk to Chairwoman Steele. Might that have an impact on how fast you allow the restaurant sector to open, how many inspectors you get?
So that would be part of the conversation when we come together and making decision on which business sector to get to reopen first, right? So that will be part of it. I don't have an answer for you now, but be on the lookout for our plan. We will put into consideration on the inspection piece as well as the success of the Safe Dining OC campaign as well. So thanks, Norberto. All right. Thank you, everyone. Have a wonderful afternoon. Thank you.